What if you could know maybe up to a year in advance that someone was at a really high risk for a serious hospitalization? And what if all the clues were already there, just kind of hidden inside the millions of data points in their digital medical records? Okay, so today, let's dive into how artificial intelligence is making that exact thing possible, basically turning our medical histories into a roadmap for preventing future health crises.
But before we get into the really cool AI stuff, we have to understand the massive, and I mean massive, scale of the problem it's trying to solve. We're talking about chronic diseases, and their impact isn't just personal, it's economic, and it is absolutely enormous.
Just look at this number, almost $31 billion. That is how much the US spends every single year on hospital care that, probably could have been prevented. And the research is really clear on this. The two biggest drivers of that cost are heart disease and diabetes. So the point is, if we can predict these events, we could potentially save billions.
And of course, this is about so much more than money. Heart disease is a leading cause of death in the United States. It's responsible for 1 out of every 4 deaths each year. That's just a staggering human cost, which makes the search for better prediction and prevention tools incredibly urgent.
And at the same time, we're dealing with what the source material calls the world's fastest growing chronic condition, and that's diabetes. In the US alone, almost 1 in 10 people had it back in 2012, and that number's only gone up, which puts this huge strain on our healthcare systems.
So, with a problem this big, where do we even begin to look for a solution? Well, it turns out the answer is in the data we've been collecting for decades, basically hiding in plain sight.
We're talking about electronic health records, or EHRs. I mean, think about it. Every diagnosis, every lab result, every prescription, every doctor's visit from your entire life, it's all digitized now. It's a massive, super detailed history. The researchers saw this not just as a record, but as a treasure trove of hidden patterns and clues.
And this brings us to the central question of the whole study. Could an AI analyze this incredibly complex history and find the little subtle signals that predict a major health event, like a hospitalization for heart failure, a full year before it even happens? Giving doctors that kind of a heads up would be a complete game changer.
Now, not all AIs are created equal. When you're dealing with someone's health, you face this really critical trade-off. Do you want the AI that gives you the most accurate answer, period? Or do you want the one that can actually explain why it gave that answer? This is the classic black box versus glass box dilemma.
So on one hand, you have black box models. The research shows they are unbelievably accurate. They can tell you what is likely to happen, but their reasoning? Total mystery. On the other hand, you have interpretable AIs. Now, they might be a tiny bit less accurate, but their logic is completely transparent. They tell you why they made a prediction. And for a doctor, that why is everything. It turns the AI from some kind of magic 8-ball into a trusted collaborator.
So with that in mind, the researchers developed 2 brand new interpretable methods. Let's actually take a look inside the mind of these AIs and see how they find those critical red flags in a patient's health record.
Okay, the first method is just beautifully simple. It's called KLRT, or what I like to call the top clues method. It scans everything in a patient's record, scores every single factor, and then it gives the doctor a personalized little shortlist, let's say the top 4, of the most significant risk factors for that one individual. This is what really matters. It goes beyond generic risk factors to find what's most critical for you.
And this table just brilliantly shows what it finds. Now, what's really interesting here is that it's not just flagging the obvious stuff, like a prior heart failure diagnosis. Look further down the list at number 8, symptoms involving respiratory system, or number 9, visit to the emergency room. The AI is picking up on what the researchers call utilization features, basically patterns in how a person interacts with the healthcare system, and it's identifying them as powerful predictors.
All right, the second method, which is called ACC, does something even more amazing. It doesn't just predict risk for one person. It automatically discovers these hidden, medically meaningful clusters of patients who all share similar risk profiles, all without being told what to look for.
So how did these new interpretable AIs actually do? The researchers put them to the test against that powerful but mysterious black box model and also against a traditional risk score that doctors use today. The results on this chart are crystal clear. First, look at the bar on the left. That's the traditional risk score. It gets totally blown away by both AI models. But here's the most important part. Compare the 2 AIs. The transparent, interpretable model performs nearly as well as the black box. You get almost all of the accuracy with all of the explainability. That is a massive, Massive win.
And hey, remember that patient grouping model? This is what it found for heart disease. It just automatically sorted patients into 3 distinct groups, like those with issues in the heart's lining, versus those with blocked arteries from past heart attacks, versus those with irregular heartbeats. These are medically relevant categories that the machine learned entirely on its own, just from the data.
And it wasn't a fluke. The AI did the same thing for diabetes, automatically discovering these distinct patient clusters. For example, it separated patients whose diabetes complicates pregnancy from those who also suffer from things like skin ulcers and hypertension. This ability to find such nuanced subgroups really shows how powerful this method is.
So what does all of this mean for the future of medicine? Well, the goal here isn't just to be fortune tellers. The real power of this technology is in moving from simply predicting risk to actively and effectively preventing it.
And the economic argument here is just undeniable. The researchers state it plainly in their conclusion. The cost of preventive care, things like office visits, tests, or medication, is orders of magnitude lower than the cost of a hospital stay. A small investment in prevention can yield enormous savings.
So the crucial point to take away from all this is this. This technology is not about replacing doctors. It's about empowering them. It's a tool that can sift through mountains of data to flag the patients who need extra attention, which allows doctors to intervene proactively, before a crisis even happens.
And this all leads to a really profound final question for all of us to think about. As these tools get more powerful and more integrated into our lives, we have to ask ourselves, how much of our personal health and our well-being are we willing to trust to an algorithm?